Good evening, dear students. Today we will discuss some clinical questions from dermatology. The very first question is about a 22-year-old male who is coming with hyperpigmented patch over the forearm, and this is present for 6 months. On examination, there was loss of temperature sensation over this patch, and there is also thickening of the ulnar nerve. Now, what is the most likely diagnosis? Now, let us write the keywords here. There is a hypopigmented patch. Yeah, there is a hypopigmented patch, and there is loss of temperature sensation over this patch. So there is loss of temperature sensation, and also there is thickening or enlargement of ulnar nerve. So 3 points: hypopigmented patch with loss of sensations plus thickening of ulnar nerve. The moment you have this kind of presentation, the answer has to be tuberculoid leprosy, right? So there is only a single hyperpigmented lesion in which the sensations are absent and there is thickening of the peripheral nerves, right? So this is a classical picture of tuberculoid leprosy. Very easy to identify. Then next question, a 6-year-old child develops itchy lesions around the mouth, and then the examination shows superficial erosions which are covered by honey colored crust, right? So the moment you have this kind of presentation, let us write the keywords: 6 years old child, then there are itchy lesions around the mouth, and lastly and more importantly, there are superficial erosions which are covered by honey colored crust. So honey colored crust. The moment you find this word honey colored crust, the answer has to be impetigo contagiosa, right? So a child with itchy lesions around the mouth with superficial erosions, classically having honey colored crust, the answer has to be impetigo contagiosa. Okay. Then next question. A 35-year-old male presents with sharply demarcated erythematous plaques which are covered with the silvery scales, and see the location: elbows and knees. What characteristic sign will be seen in this condition? So firstly, we have to reach up to the diagnosis. So here we can say young male, obviously 35 years, then sharply demarcated means well defined. So we can classically say, okay, this area is diseased, this part of the skin is normal. Erythematous plaques. Erythematous means red. So erythematous plaques, and the classical word silvery scales. And see the location, that is the knees and elbows. It means which aspect of the body? Extensor aspect. Clear? So if you have this kind of presentation, erythematous plaques, that is redness there, then silvery scales, and especially over the extensor aspect, the clinical diagnosis is psoriasis. So what is this? This is psoriasis. And in psoriasis, what sign we will be seeing? We will be seeing auspit sign. Now, what is auspit sign? Removal of scales, right? So if we remove these silvery scales, what will happen? There will be pinpoint bleeding. So this is the auspit sign, a classical sign seen in psoriasis. So the answer here will be auspit's sign. Then moving forward to next question. A patient with ring-shaped itchy lesions and he applies topical steroids. And then after that, he develops diffuse erythema and poorly defined margins. Now, what is this? So, initially, if we write the initial presentation, so initially, the patient was having ring-shaped or what we call annular lesions. So, ring-shaped lesions, these are itchy, it means pruritic, and then to this the patient applies topical steroids. Topical means some steroid cream. Now what happened as a result of this, the presentation of the condition or the presentation changes as such. So there will be, what is happening? There is diffuse erythema, but classically the margins become poorly defined. So poorly defined margins. So what is happening? The presentation or the outlook of the lesions have changed because of the application of topical steroid. Now this is classical for tinea infection, right? So this is classical for tinea infection, and when a patient applies topical steroids by taking it from a pharmacy shop without consulting a doctor, the configuration or the shape or the character of the lesion, it might change, and this condition is known as tinea incognito. Means it is very difficult to identify that is these lesions really tinea, because they will change drastically if the patient is applying topical steroids by himself without consulting a doctor. So this is tinea infection. The presentation of the lesions changes on application of topical steroid, and then now it will be known as tinea incognito, means it is very difficult to identify. So incognito means difficult to identify or difficult to recognize. Okay, so difficult to recognize. So this is classical presentation for tinea incognito. The next question, a 50-year-old woman develops painful oral ulcers which is followed by flaccid bully over the trunk. And then there is one more important hint. Nikolsky sign is positive. Now what is the diagnosis? So let us write the keywords first. 50 years old woman. Okay. Then she developed painful oral ulcers which later on is followed by flaccid bully over trunks, and there is one clinical sign positive, that is the Nikolsky sign. Now this is classical. This is classical for pemphigus vulgaris, right? So there are oral lesions and the bulli are flaccid. So this is very important here. Now what is this Nikolsky sign? Nikolsky sign is clinical demonstration of acantholysis, right? So it is clinical demonstration of acantholysis, and whenever we give a tangential pressure to the normal skin surrounding the bully, there will be shearing of the skin. So that is clinical demonstration of acantholysis. And acantholysis means that there is loss of coherence between the epidermal cells. So this is the classical presentation for pemphigus vulgaris, and the classical clue word is flaccid bully. Okay, next question. A 70-year-old man develops tense, itchy bully over the abdomen and thighs, but oral mucosa is normal. So now here, 70-year-old patient, the bully are itchy but tense. So tense bully and oral lesions are absent. So there are two important differences which you can just note down here. Tense bully, no oral cavity lesions, and there is itching over these lesions. And you can also say much more older than what we see in pemphigus vulgaris. So this is the classical presentation of bullous pemphigoid, right? So this is how you will differentiate pemphigus vulgaris from bullous pemphigoid. Here the patient is slightly more older, the bulli are tense, unlike flaccid bully of pemphigus vulgaris, and there are no oral lesions. We saw that in pemphigus vulgaris there are oral lesions. So that is how you have to differentiate the two conditions, pemphigus vulgaris and bullous pemphigoid. Here both the conditions are autoimmune. So here in pemphigus the antibodies are directed against desmoglein 3, which is present in desmosomes, and in pemphigus vulgaris the antibodies are directed against hemidesmosomes. Okay, so this is additional thing which you need to remember for the two conditions. Now, a college student has severe itching that worsens at night, and similar lesions are, or similar presentation is also present in the roommates, and there are burrows which are seen in the finger webs. Now this is a very classical case. I think all of you can identify it. So if we write the keywords, severe itching, number one, worse at night. Okay, worse at night. Then similar symptoms in roommates. It means the fellows who are staying with him also having the same problem, and classically there are burrows in the finger web. So the moment you have these kind of words, severe itching, more at night, involvement of other fellows and burrows, straight away the answer has to be scabies, right? So this is a classical presentation of scabies. Then moving forward to next question. A middle-aged woman develops itchy, purple, polygonal papules on wrist. What is the diagnosis? Now here, instead of itchy, you can write pruritic. Okay, you can also write itchy as pruritic. So now what you can see? 1P here, 1P here, 1P here, 1P here. So this is classical for lichen planus. Okay, so this is classical for lichen planus. You can see one more P here. So there are many P's which can be remembered for. So 5 P's of lichen planus. Let us write. First is obviously purple colored. Then another P is, say, pruritic, means itchy. Then third, polygonal, right? Then plain. Plain means flat topped. And lastly, papules. So these are the 5 P's related to lichen planus. Purple, pruritic, polygonal, plain, that is flat topped, and obviously papules. So this is lichen planus. Classical description for lichen planus. Remember 5 P's. The next question. A 20-year-old develops a large oval lesion, and after 1 week there was multiple lesions which are directed along the cleavage lines, right? So a 20-year-old develops a large lesion which is followed by 1 week later by multiple lesions along the cleavage lines. Now what is the diagnosis? So let's write the keywords first. Firstly, there was a large oval lesion, and after 7 days there were multiple lesions which are along the cleavage lines. Okay, so these are along the cleavage lines. Now what is the diagnosis? This is a classical description for pityriasis rosea. The initial lesion is known as Herald patch. Clear? So this initial large oval lesion is known as Herald patch, and then there are multiple lesions which are along the cleavage lines. So if we look at the patient from the back, so the lesions are like this, and this is known as Christmas tree appearance. Okay, so this is known as Christmas tree appearance. So these are the 2 classical keywords which makes the diagnosis of pityriasis rosea. So Christmas tree appearance and Herald patch, right? So this is pityriasis rosea. Then next question, a child has recurrent itchy lesions which are involving the flexural areas, and there is history of asthma also. So child recurrent means again and again. Itchy lesions, itchy lesion means pruritus, and which part of the body? Flexors, so flexural areas. Flexural areas like elbow, cubital fossa, knee, popliteal fossa, right? So fossas around the elbow and knee. And then lastly and more importantly, history of asthma. So such a condition in which there is some history of atopic condition and there is severe itching, it is known as atopic dermatitis. And there is so much of itching, this is also known as itch disease. That's why it is also known as itch disease, because there is severe itching, right? So this is a classical presentation for atopic dermatitis. Now, just a quick recap. So if there is a white patch, that is hypopigmented patch with, right? So if there is a hypopigmented patch with sensory loss in that patch along with enlargement of the peripheral nerves, you should think of tuberculoid leprosy. Clear? So this is tuberculoid leprosy. White patch, that is hypopigmented patch. White means hypopigmented as compared to the surrounding skin. Then honey colored crest, especially around the mouth, think of impetigo. Okay. Silvery scales, Auspit sign, think of psoriasis. Purple, polygonal papules, 5 P's, lichen planus. Night itching plus burrows, think of scabies. Oral ulcer, flaccid bully, think of pemphigus vulgaris. Tense bully in elderly, this is bullous pemphigoid. And herald patch, this is classical for pityriasis rosea. Okay, so if you find these keywords in the exam, just be quick to make the diagnosis and be sure that okay, I'm making the right choice. So don't do any error in such a simpler questions, straightforward questions, and just score full out of full in such repeated and important questions. So that's enough for today's session. Thanks for joining. Good night.